on Tuesday, April 21st at 6 p.m. Would you please silence any noisemakers you may have, including background TVs or other paperwork that you're going to rustle around your microphone? And please join me in reciting the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America
and to the republic
for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Roll call, please.
Lino,
Here.
Baker,
Here.
Berto,
Here.
Bell,
Here.
Duffy,
Here.
Kadunko,
Here.
and Nino.
Here.
Okay. Approval of the agenda.
So moved. I'll second it.
Changes, deletions, grammatical remarks, other errors, omissions? If not, all in favor?
Aye.
Aye. Opposed? Carried. Do we have two sets of minutes?
There's one from March 17th and one from April 14th.
Okay. So the rest of the minutes. We need a motion for the minutes.
I'll make that motion.
For both sets?
Yes, for both sets.
Is there a second?
Second.
Okay, any changes? Anything to respond to on either set? Okay, all in favor?
Aye.
Aye. Opposed? Comments and correspondence. Does anybody care to make a comment about a non-agenda item that's online? Correspondence.
There's none that I'm aware of.
I've got none either.
Okay. New village board business. Item number 1, administering of the oath of office to recently elected village trustees, Denise Berto, Pat Duffy, and Vivian Nino. Congratulations, all of you.
Congratulations.
Thank you.
Okay, so Pat, Denise, and Vivian, this is a little strange way of administering the oath, but if you would please raise your right hands and then answer at the end of this oath. I, the undersigned, who have been elected to the office of trustee for the Village of Sister Bay in and for the Village of Sister Bay, but have not yet entered upon the duties thereof, swear or affirm that I will support the Constitution of the United States and the Constitution of the State of Wisconsin, and will faithfully discharge the duties of said office to the best of my ability, so help me God. Please say, I do.
I do.
Thank you, and congratulations.
Congratulations.
Item number 2, discussion regarding an update on the village's response to COVID-19 pandemic. Consider a motion for action if necessary. I will start with that. The latest update today from public health at the county level is no new cases overnight. We have about 10 or 12 out for testing yet. Out of the 9, of course, we had the unfortunate 1 death. 6 are considered recovered and passed their 14-day isolation after symptoms. And so 2 are still active. I think the expectation is, I think by the end of the week, they will have passed their 14 days also, or very close to it. So shortly, we may have, quote, no documented cases. They still believe that, in fact, there is coronavirus circulating in the community, but that it has not necessitated any medical intervention at this point in time. Of course, everybody's familiar with the bounce back that the governor published yesterday. Everybody's still trying to go through that and figure out what it actually all means and when and how. I will note that Governor Evers' bounce back plan uses the federal government's bounce back plan, if you will, or reopening plan. And that's what he's got it based on. And if you look at that, at this moment in time, the state of Wisconsin does not meet the requirements yet to move into phase 1. We have to have 14 days of declining new virus positives and 14 days of declining hospitalization and ICU usage, and we're not there yet. I will also note that today the state of Illinois, and I think it's important with a neighbor like that close up to us, is determining that they probably will not reach their peak until the middle of May or the third week of May is what they're projecting now. So they're still looking at quite a ways to go with them. Wisconsin continues to rise. I think we had a 19% increase over positives yesterday to today. So that continues to rise. And of course, we're very concerned about some of our next door neighbors in Brown County with the sudden increase or quadrupling of cases down there, basically in a day or two. Of course, they're at food packing plants, which seems to be the latest issue around the United States. I think I mentioned last week, and tomorrow will be the first official meeting. We have a long-term opening committee or task force committee that's been formed. I know Louise will be able to talk about this a little bit, but we're getting together members from the county, from the city, the Emergency Operations Center. All these words are going through my mind. I have to get them all right. The health department, as well as state officials. And we will be bringing in DCECD, Destination Door County, and we will bring in groups as necessary. And the idea behind this is to begin planning for the long-term rollout of, quote, getting back to a semi-normal condition. And so we're asking various groups to begin to think about what they can do or what they would like to see done. At the same time, we're asking the state to clarify their bounce back program and get down to the nuts and bolts of it. For instance, if they're going to reopen certain businesses, what do they want those businesses to do as far as isolation or mask or gloves or sanitation practices? And that's what we're kind of looking for. The other thing we're looking at is what do we do, for instance, in Northern Door in particular, with all of the festivals coming up this year. If the expectation is that we're not going to go back to even a regular normal until much later in the summer or into the fall, if at all, but we'll get close to it, hopefully. What do we do with thousands and thousands of people coming up? What do we do with concerts? What do we do with movie nights? Those are all the kinds of issues that we'd like to try and begin planning on now. They're still a little ways out, but that time's going to come quicker than we probably want it to. So I have talked with Miles. I also talked with Dave Elliott. Miles, I know you're on the line here, and had some discussion with him yesterday about, or the day before, yes, yesterday, I'm sorry, about media messaging and how we need to get that out and work with our business community and our government community and our residents as to what and how this is all going to occur. So there'll be a lot of discussion, but it's good to see that that task force is now formed and we're kind of moving in that direction. We're anticipating that we're going to get there. If you look at what Wisconsin has done overall in the last 6 weeks, it's only been 6 weeks. If you recall, this started March 16th. After I shortly got back from Aspen, was the date I always remember. And it's only been 6 weeks, and an awful lot has happened. If you look at what the coalition has done up here, the Fire Chief Coalition, it's been fantastic. If you look at the support that we've gotten throughout the county from various groups and organizations, it's absolutely fantastic. If you look at our residents and they're doing their social spacing and wearing masks and being careful with things, staying at home, it's been fantastic. We've got really good compliance. Is everybody going to comply? No, but we've gotten great compliance, and I personally feel that has done and gone a long ways for us here in Door County. We do not have community spread yet, which is a great thing, and I think that's because we're somewhat isolated, of course, but at the same time, everybody is doing their part in their social responsibility to their friends and neighbors, which is great. So that's about all I have to say at the moment on that. I guess I would ask, is Chris online? Chris Heck?
Yeah, Chris is here. I'll mute him.
Chris? Chris Heck?
He's here. He's just trying to
Yeah, I'm
unmute.
here. Go ahead.
Okay,
I'm here.
go ahead. Do you have anything you'd like to report or bring us up to date on?
No, I mean, we continue doing what we're doing, and thank you for your kind words. It wouldn't be possible without all the volunteers we have and the cooperation with the businesses. We'll just keep doing what we're doing, and as the situation changes or different businesses come forward, we're doing what we can to help them and the individuals. So, no, I mean, if anything, I would say that, when we looked at building this out, we looked at it ramping up pretty quickly and being fairly intense and then plateauing. And we're kind of in that plateau where we're kind of holding our own, and there's a few additional tasks that we're taking on. A lot of it now in cooperation with the Public Health Department and Dan Kane. But it's good. We're up to 560 volunteers, so quite a few.
Wow. That's great.
And it is volunteer week, so if you see a volunteer, thank them. But no, I don't have anything to add. I think we're doing the right thing. I think we just need to be careful that we don't get complacent,
Yes.
for lack of a better term, and I know there's an awful push to open everything back up. And I feel that, I understand that, but just simply what's going on here, it would be nice if we could be done, but I don't think we should be done. And yeah, we're asking people to give up 6 more weeks or whatever it is, but do you want to give up 6 more weeks now, or do you want to give it up in June and July? And we can play the game and take the chance that it's not going to come back, but I don't know. If Illinois is staying shut down and we open up, you know what they're going to do.
Yep, definitely. All right. Thanks, Chris. Appreciate everything you guys are doing. It was funny today when Dan Kane was giving his Emergency Operations Center update. He said what everybody has seen is people are kind of falling into 2 camps now, and there's a real polarization. And one camp is keep your social distance, keep doing what we need to do for social responsibility with each other, stay isolated, and do that, and by far in a way that's the vast majority of people. But there's also another camp that says, oh gosh, look, it isn't nearly as bad as we thought. It's time to start loosening things up, et cetera. Well, it's probably not as bad as everybody thought it was going to be at that point in time, or at this point in time, because everybody was doing what they were asked to do.
Right.
And as Chris said, you got to be careful reopening too soon, as much as everybody wants it.
All you got to do is read about the Spanish flu, whatever year that was. The second go round was what got more people than the first go round.
Yep. Jay.
Yeah, we're just trying to do everything that we can, at the Piggly Wiggly. We're going to institute tomorrow sanitizing all our carts twice a day. So we got some good sanitizer that we're just going to push them outside and take like a weed sprayer, and spray them off and all that and try to get them. This week we moved with having a checker stand out and wipe down the carts and the baskets, and a lot of people have really taken hold of that. They really appreciate that. I was lucky today. I did get some more cart wipes. Otherwise we were going to be running out, but we got a bunch of cart wipes, and we should be in good shape there. Chris and I did talk about, how many people that we can have in the store and that, so we kind of have that down pat, and we've been doing head count about every 2 hours in the store, and we don't even come close to the number right now, but we're keeping records of that also. And the food is still coming in slowly, as everybody can see on the news and that. Meat prices are probably going to go up because all these meat plants are getting shut down with the virus and that. So, that's going to be one tough thing. We're trying to buy in some extra so we can hold the price for a while, but should see that possibly go up. But we should see the dairy prices going back down because they're getting that figured out. And otherwise, my staff is doing a great job, and the volunteers that Chris has coming up to us, we're getting a lot more call-ins, and like I said last week, it's nice that my 2 daughters are getting more phone calls at the store than what I am. So people are calling in to get their groceries. So it's been a good thing. It's been a good transition, and I think we got it rolling pretty good where you send in or you call in and you get your groceries the same day. So we're not like some other ones where it takes 2 or 3 days. We're getting them out in the same day. So it's working out great.
Okay, great. I've been asked by a number of people with the meat packing plants closing and food production plants. As you said, you could probably expect some price increasing coming. Are you expecting any shortages at this time?
I don't think so. Right now, one of the main concerns actually is getting the animals to the plants because the plants are still working a little bit. And then one weird one came up today where some of the plants are worried about getting cardboard boxes to put the meat in because they're making so much toilet paper yet that they won't be able to keep up with the cardboard boxes. So I don't foresee it too much. I just kind of see that there'll probably be a little spike in some of the prices and that, but I think that they have a lot of things stockpiled up pretty good that I think the prices should hold. Like I said, they'll go up a little, but not, I don't think drastic.
Okay, great. Anybody have any other questions for Jay?
I do. I was just wondering, whether it's the pig or the restaurant Cisco who delivers up here. Do we have to be concerned about any of those entities getting product from some of these plants that have had huge breakouts?
I don't deal with Cisco, but I know, we deal most of our meat through the Piggly Wiggly. We got a place in Milwaukee that has it, so that's our distribution point. And we talked to one of the main guys today, and he didn't seem overly worried that we were going to run out or be shorted. So things could change. Obviously we've seen things change quickly, but I just hope that there's not a rush to the store to buy up all the meat that they can, and I hope people just realize that if we do it sensibly, it's going to be all right.
Well, that was not really my question, but thank you, Jay. It was more of, could any of the food be contaminated? I mean, I know Cisco delivers to the restaurants. I don't know where they're getting, their meat and their bacon and all this other stuff. And
Denise, I'll talk about that a little bit. The timing of what it takes for them to get it from the field or get it from the factory or the processor until it gets to us is probably more than enough time for whatever to be on there. It's not foolproof by any means, but then that's handled with cooks that wash their hands, and then it's prepared and cooked to temperature. Now, is it possible? I'm sure, but I think of all of our concerns, it's the face-to-face, it's the aerosol that is what really makes this so contagious. What I've been reading about surfaces, yes, you can get it, but the idea that you're going to touch a surface and lick your finger and even get it is probably really hard, because it's an aerosol form that it gets in your lungs is how you really get it. It's not just saliva. So I'm not an expert, but from what I'm understanding, I think that's the least of our concerns. You were more likely to get it from a driver that talks to a cook than you are from it being on the food.
Exactly.
I was just curious.
Yeah, that was a good point. That's pretty much what it is. The stuff sits, like Chad said, long enough that it shouldn't have it in that. So, I mean, could it? Yes, but in all likelihood, no, because like he said, you get it more through the respiratory in that.
Okay.
I
Thank
just
you.
want to add something. When Jay was talking about meat and potential shortages and price spikes, everything I've seen and what I heard today was that they're expecting a lot of these meat plants. It'll only be a week or two before they're back up and running. They're trying to find out everybody who has the COVID virus or can spread it and do that tracking and tracing. And they're going to put in place the social distancing thing. And as Jay said, most of them are still operating on a limited capacity. So they're only expecting at 2 to 3 weeks that there's going to be this kind of blip in there. And so it should not affect the supply per se overall, but you may have some, small stores or small regional areas that have a problem with distribution. But other than that, they're saying it shouldn't be that much of a issue in the distribution. Any other questions for Jay? Louise, are you there?
I am.
You done with the potato chips or whatever it was? Or?
No, it was Triscuits. I'm done.
Triscuits, I'm sorry.
I
Okay.
got a few left. Not many,
Okay.
though. I
All
ran out of cheese. So I'm going to have to wait. So most of the questions came up, or I think the big conversation now came up after Badger Bounce Back was published. And I think probably the first one was when would phase one actually kick in. So do they start looking at kicking phase 1 in on May 26th, which is the end of Safer at Home? Because when you look at the document that was published, there's 4 columns, right? And so they look like that.
Mhm.
So you have a column that says Safer at Home, then you have phase 1, then you have phase 2, then you have phase 3. So when you look at that, logically you would think, okay, we have got to get through Safer at Home first, ends May 25th. So we start counting 14 days, 6th. We start counting 14 days on May 26th. So if I ask 5 people that question, I get 5 answers.
Okay,
I
well,
think-
the way it was explained to us at Public Health
Yeah,
was we are not in phase 1 yet. We are not entering phase 1. That was simply his publication as to how he would look at and handle it, looking at science.
yeah,
And until you get 14 days of a downward trend on positives and 14
Right.
days on a downward trend of hospitalizations, you do
Right.
not enter number 1. So if you
Right.
look at it from that way, if you took it from now through the end of May, that's the earliest that you'd probably be able to enter.
no matter what, it's going to be end of May anyway. Got
Yeah,
it. Yeah, because we haven't even entered it yet. Got it. Okay.
Right.
All right. Then when you start looking at phase 1, so the questions, what I think our businesses are looking for is some clearer direction that, in all likelihood, will not necessarily come from the state, because it's very difficult for them to not do something that isn't more of a blanket measure.
Sure.
So as an example, one for opening phase 1, opening restaurants, yes, with best practices and a question mark. So the question, or I think that the businesses, and whether it's Sister Bay or Egg Harbor or Fish Creek or wherever, I think it would be great if the county was consistent. Now, it's arguable, but whether everybody's going to agree on what those best practices are and love them, and every village is going to love them, but the point is that if it's a best practice, it's a best practice for a restaurant. And so when the question would be whether the state intends to give more clarifications on this, and if they don't, does the county, and would Sister Bay, since maybe that Sister Bay wouldn't necessarily take the county's direction. Do you see what I mean? So that we have a restaurant in Egg Harbor having a set of best practices that could be very different, still great, but very different than best practices that might happen. So we have a visitor that comes up. We're trying to set a guest visitor's expectations, and they're going to be very different. So I'm not asking for an answer. I'm just telling you things that, and same with bars. So phase 1 is no, you can't open, but allow takeout and delivery. Phase 2, yes, but best practices. So what exactly is that? So you could go down the list. And then on a general basis, would the county, would the county put an order through that everybody has to wear a mask? Or would we would prefer not to have a situation where you've got one village that prefers everybody wear a mask and one town doesn't? Or is that something that's just going to evolve naturally and it'll depend on the community? Public restrooms. One village is going to open their public restrooms, one town isn't, and one city is. So these kinds of things are things that would be good to be consistent, and I so understand how difficult it is to get everybody, villages, north and south, to agree on it. But so we view it from, the coordinators view it from a visitor experience, and the businesses want direction. They just want to know, so they just want to know and want some help directionally on what to do. So if it's lodging, because nobody's telling, and they're open now, right? Many of them, and they're essential. Nobody's telling them how to clean. Nobody's telling them how to do anything. So you just hope that your proprietor or your Airbnb owner knows what they're doing. So what we're trying to do is have that visitor leave with a great experience. And I understand that not everything can be consistent. Then as it relates to activities, so you have beaches. We have one of the largest. So, those are things to consider. We're not the only one with a beach. We're not the only one with pools. We're not the only one with playgrounds and things like that. And this is a tall order. But, so it's something that I think we as a group, coordinators or the recovery team, should think about, because as you roll these out, I mean, festivals and events are a whole nother thing, but you have county parks that might be run very differently than state parks, maybe. So I think that consistency is important. The other thing that keeps continuing to come up is, how do we message to our visitors that we really want them to come? We know that we asked you to stay home, and we asked you to, just think about coming and plan your trip, but postpone it. But, we really like you to come now. And then how do we greet them? So that's probably messaging that would be destination Door County. And that's probably would be, and also be messaging from the individual communities, so that they don't feel, any kind of backlash. Those of them that might have felt that, they don't want me to come anyway. And personal opinion, I'm not hearing a heck of a lot of that. And I'm not, by that, I don't just mean visitors. I also mean seasonal homeowners. And then as far as festivals and events go, with the coordinators, we talk about it every week. And now that we've gotten the Badger bounce back, which for festivals and events, for mass gatherings, basically through 4th of July, anything that we do, because most of anything we do has more than 150 people. So
let me jump in for a minute and try and address a couple of your points before we get too far down the line with the list of points. In the most recent order, I don't know if you picked up on this or not, there is a FAQ that was also published after that.
Yeah.
And if you read that, if you read the order for the bounce back piece, they clearly state that the state of Wisconsin supersedes all local orders unless a local health department has declared something different.
Right.
In conjunction with the state health department. So they did that to allow local control or local issues to be different than statewide. That's what they were attempting to do. Okay? Now, of course, the way they stated it has caused other questions, but basically what we were told today was basically what they're trying to do is they're trying to have an overall authority from the state, but allow local flexibility if necessary as they move through these phases. Okay. Everything you mentioned, Louise, is all the things that we hope to begin addressing on that long-term
I know.
task force starting tomorrow. And I know that you've been in contact, or John Druish has contacted you about giving input for that from all the coordinators.
Yep.
So that's all good. So yeah, but I agree right now there are many, many more questions on this than there are answers yet.
Yeah, it's just a matter of planning for it. If we have enough time, and it sounds like we're going to have time to at least, give our businesses some direction as it relates to what their best practices are, especially in two major channels, which would be restaurants and which would be dining and lodging. And in many other cases, these are what happens. A lot of everything else that happens on village or community property.
Yep.
And let's see what else. We've got some restaurants that haven't opened yet we're thinking about opening. We're probably going to wait till Memorial Day, which now would mean that if they open, they would go to a takeout model. And I think a couple are thinking about doing it, and some are going to hold off. I don't have definitive answers, so I don't think JJ's knows yet. The Boathouse, Waterfront, etc. But I think everybody that's doing takeout is doing a great job, and doing the best they can. And we're encouraging those that do to figure it out so they can keep doing it when their capacity goes down. And we're encouraging anybody that doesn't have e-commerce on the retail side to figure it out, because that's a whole nother store for them if they can do it, and they can do it relatively quickly, even if it's not a lot of inventory, just a few SKUs, it's something, and there's no staff. So those are things that, and the other piece of it too is stores that are open, if there's fewer people can be in the store, and it's a tight store anyway, so it's 600 square feet, something like that, and they base the number of people you can have in a store on your square footage. I'm curious about, at least in Sister Bay, can they bring racks outside? I don't want it to look like a bazaar, Denise. I'm not suggesting that. It's not a sidewalk sale. But can we figure out a way for them to do, if it's a 600 square foot store and they're allowed 3 people at a time. I'm thinking of Spot, for instance. That's not a big store and there's a lot of people in there. So thinking about that, I'm thinking about other ways that, like dining, they could eat outside. It's great. So how can we help retail do sort of the same thing? So try to figure out a way to do more business outside of their regular model, online, outdoors, something like that.
Louise, a little bit on that note, I think whatever we can do as a village board to help out any of our businesses during this time, we're going to do. And if that means maybe putting a tent up longer than normal or being outside, I'm just speaking for myself here, but I just think we're all kind of like-minded. We're all going to be looking at this in very practical terms, and to do anything to be helpful, I would imagine would be our goal.
Mm-hmm.
I think we would all be open to
different things,
doing what we can to assist. Right.
Mm-hmm. Great. Great. I know that they would, I think they would all appreciate it, and they're all dying because they all got inventory and they're all either trying to cancel an order or hold off an order, and then they get it. They got to sell it. So, and hopefully we get the people up here to, they can buy it. But anyway, in general, I think spirits are still pretty good, and the news that we were going to be closed a little bit longer was, not great news, but I think for the most part, people understood.
Okay. Any questions of Louise by anybody? Okay. Thank you, Louise.
Mm-hmm.
John, Lowry, anything you'd like to add tonight?
No, except we're working our way through the maze like everybody else.
Okay. All right. Miles?
Yeah, I've spent most of the last couple of days talking to business owners, a few dozen, about the first the extension and then the new guidelines that came out. I'm kind of surprised. Most say, out of all the ones I talked to, there were only 2 that even insinuated that they would be comfortable or prepared to open on May 1st. So the Tavern League's push for that, I didn't see a lot of push for that locally. I saw a lot of people saying maybe mid-May, and I was also surprised how many people I talked to said they're prepared to give up Memorial Day for the sake of the rest of the year, if it can salvage it. So that was kind of the feedback I was getting on that front. In fact, several restaurant owners told me, they're just still trying to figure out how do we open when we're going to be under such a tight microscope. Every customer that comes in is going to be watching every bartender as they wash their hands, every server, how they interact, how everything's wiped down. And you thought the Yelp and TripAdvisor reviews were bad before, and what are they going to be in for?
Yeah.
Yeah.
James Larson is going to have a field day with people.
We're going to check phones at the door. That's what we're going to do.
So that actually seemed to be the sentiment, and a lot of people actually already talking about some really creative ideas. And I won't give their ideas away here, but I'm impressed just how much people are looking to solve problems. The other thing I've been thinking about is now that we're getting through the April part where it's still, it's not beautiful up here, right? Once we hit May, as much as we think that a lot of people came up here and opened their seasonal homes and started to take day trips before, whether we put warnings out or tell people to stay home or not, we're going to see a bigger influx in the weeks ahead, in early May even. And I think we got to start preparing for how businesses should handle that and welcome it and treat people right. Mm-hmm. But also, how do we prepare for that, as a community and as municipalities and a health department? Because it's just going to happen at this point. There's no more small reminders, I think. Not that it's going to be like normal, but there's going to be a lot of that. Restaurant owners told me, they don't want to be the source of the outbreak. A lot of them seem like they're nervous about being the first one that something's traced to, and dealing with that, because they say if that happens, we're done for the year.
Right.
So some interesting stuff from the restaurants of being actually more cautious than you would expect. The other thing, this is maybe a question for you, Dave, is, well, actually, one more thing is, the more I think about it, the more I think like small retail, it might be one of the easier things to open up versus a lot of the other aspects, especially if I'm a small retailer and I'm watching Walmart be able to sell all the products that I sell, or Target or Walgreens with 50 people in their store, and I can't have 2 people in my small independent business in Sister Bay. I think that is something the state should be looking at. But then from a county level, once this starts, we do have some sort of small opening, or that phase 1. What is our preparation level to handle an outbreak of even like 10 or 12 cases and try and contact and trace and contain that? I did talk to Joel Kitchens on our podcast today about this. It doesn't seem like they've really thought about that in terms of funding more contact and trace personnel to really contain something like that. I know our local public health department isn't a sprawling network. And having that in place is crucial whenever we open up anything up here, because we'll be welcoming a lot of people from hotspots. Inevitably something might happen, and we just want to be able to contain that as best as we can. So that's most of the stuff I've been talking to business owners.
I have a brief response for that last one about contact tracing and such. The public health department, working with the hospital, and the hospital reiterated it again yesterday, feels they have a pretty good contact tracing program in place. They are not overwhelmed. When we had the 9 cases, they were not overwhelmed at all. They felt they were able to handle that without any problem or difficulty as far as staffing and people to do it. And they were able to track and trace all of those contacts for those 9 individuals and track it down, which is obviously what also helped keep it where we are now with the 6 recovered and 2 active. So based on I know they were also surged up somewhat at the hospital to be able to do some of this. So at the moment, the word has been that they're comfortable. They expect more cases, of course, but they're comfortable that at this point in time, they are staffed and could do a fair amount of contact tracing with individuals if necessary.
Dave, could I make a comment or question?
Sure.
I think that's good to hear. I think that works under maybe today's environment, but when we're welcoming tens and thousands of people up here, and say it's 2 Husby's employees that have it, and we didn't know, and they didn't know for a while, and there was over the 10 days until they figured out they had it, there was 3,000 people that came in that place, and then spread all across the country. I know Apple and Google are working on a Bluetooth app for your phones, and it's going to be a while, and people are going to have to sign up for it, and that's civil liberties. A lot of people won't, but I think, when it comes to that kind of contact tracing, we're not even going to know their names. If you're serving somebody, you're not even going to know who you were in contact with. So I think there's a lot of,
but that's also part of the contact tracing issue. I mean, there's multi layers in the contact tracing issue, but all the health departments in all 72 counties are also hooked together to assist in contact tracing within the state of Wisconsin. Now, if somebody's coming in from Illinois, that may be obviously more difficult, or Minnesota or whatever, they flew in for the weekend and left again. Those kinds of things, no, you probably never will. But the local contacts, as far as the traceability and what they can do locally and throughout the state, that program is in place. And at the moment, they're comfortable that they can handle where we're at and a surge. Now, obviously, there's going to be an upper level, where it's going to be exceeded. But at the moment, with what they're seeing and where they think it's going, they're comfortable.
Okay.
Miles?
That's all I got.
Okay. Any questions for Miles?
Well, Miles, I was on a call this morning. Prevea had a call that what my counterpart, Neg Harbor, made us aware of. So I jumped on. I think there were 400 people on it. And I think it was the chief medical officer. And so he was asked a lot of questions, and there were a lot of business owners on there. And one of the things that he suggested was, because it's, Chad, you bring up a good point, but it's also the businesses protecting themselves and their other guests from guests that are walking in that could be, might not be well. And so, how do you do that?
That's our biggest concern.
Right. So how do you do that besides take everybody's temperature, and maybe you don't, and now this is a physician. This is not a guy that owns a restaurant, but who suggested that, you post a sign that says, if you have a temperature or sore throat, if you've lost your sense of, you need to, now is it going to mitigate anything that happens to you if somebody gets sick and says, I was at Husby's? And no, but because it was a topic that everybody asked. As a business owner, how do I protect my employees? More or less, how do I protect the guests from my employee? So how do you it's hard to screen for that. But it was a suggestion he had. I don't know how I feel about it, but it was a suggestion that he had. So I mean, there's larger chains that are taking temperatures, but I don't even know.
I'm way more concerned about our employees than I am about an employee giving it to a customer.
Right.
I was just saying that as an example of how hard it's going to be. Me, Chad, behind that bar, I saw 1,000 different people. I didn't know any of their names.
Yeah, right.
The contract. Where do you go? That was my point in that, was just to try to understand if and what can be done with that. But I agree, Louise. I mean, that's one of our biggest concerns. I know people, Miles mentioned that some people are worried about the liability. I had a customer of ours in property management worried about it. And I just said, and I don't know and I know they're really good scientists about figuring out where, when, and how. I don't know if all the resources will be going into every single buddy's case to be able to figure that out. I told this woman that, I mean, really, unless you're teletransported somewhere, you're really not going to know where you got it, possibly, if you were exposed to 1,000 different people. Or if you're, going to this many different places. Now, if you stay at home, you only went one place and you came back home, really easy to figure it out. But a lot of these people traveling here, they're going to be stopping at gas stations and getting to go with food and going to a grocery store and doing 100 things before they even get here. Right. So none of us want to be part of spreading it. But as far as liability coming back on us, I don't think that's a big concern, I guess, because how are they going to figure it out?
Yeah.
Well, one of the things that when you watch the tracing is what they're going to do is look for a commonality, because it's not going to be one person, right? You're going to have multiple people. Mm-hmm. And then what they do is once they start tracing multiple people, they go, oh, what do these people have in common? Oh, all 7 of these people were at the same funeral on February 27th. Or all 50 of these people were at this kid's birthday party. That's generally what has happened when they've traced it back, is finding a commonality in that thread. And then they find somebody, and eventually, a bartender in Brooklyn came back, and it turned out, all right, he died of coronavirus. They traced it back, and they found out his part-time bartender died of it, and they can start to trace those. So there's some of that, but they weren't talking about liability in terms of any sort of like legal repercussions. They were just saying, like, once people think it's us.
Well, the other thing I want to mention about
the log den's the one that comes to mind.
What I want to mention about contact tracing or tracking is it's also only one arm of what they're trying to do. Fortunately, we don't currently have any, quote, community spread. When you have community spread, the contact tracing becomes much less efficient. And that's when you have to go into mitigation and the social distancing, which is why we have those two things. So if the contact tracing is not effective because you're starting to get community spread, that's why you have the other legs of the stool, if you will. So I don't want to give you the wrong impression that contact tracing is the end all be all. It's not. But in the bounce back order, if you take a look at that, what they are trying to do is when we run into a problem where a hotspot pops up, they will focus intensely on the contact tracing to try and bring that under control in that particular area. And that takes more than just a local health department to be able to do. So
Makes sense.
Chad, it scares the hell out of you every day. I mean, every day I'm looking at my employees and that, and it's just, I envy them because, I mean, they come to work day in and day out, and it just scares you every day.
Definitely. Okay, anything else for Miles? All right. Is there anybody on that I missed that we normally talk to? I don't think so. Okay. Is there any other questions or comments or any discussion on the COVID-19 as far as the village goes?
I have quite a few things, Dave.
Sure, go ahead.
You talked about that ad hoc committee down at the county. and that they're going to be meeting tomorrow. Can you tell me who they are?
Okay, it's not an ad hoc committee. It's a long-term rollout task
Okay.
force that's through the state into our local emergency operations center. Okay, so Dan Kane is the leader in that because it's under that department. But who we have on it so far is Ken Pobick, the county administrator, myself as county chair. We have the mayor of Sturgeon Bay. We have John Jarouche from Destination Door County, and we also have Steve Jenkins from DCECD. And the idea was that would be the core group to begin discussions, but that we were going to each go out and begin to talk to other groups. So for instance, I know John talked to Louise and other coordinators throughout the county to start to get input and start to get questions, to start to ask how we're going to handle things and some of the directions we need to go. I mean, if you think about it, there are thousands of things to try and answer, thousands of questions to try and answer for all the businesses and everything that we do, visitors, tourist-wise, hotels that are going on in Door County, that all have to be answered under this plan as they roll it back out. So the idea was get the local input and begin to work towards what the possible solutions are, but to get everybody involved as much as possible. And of course, there'll be more people joining the group the further we delve into it. When we started the daily health department briefings at 10 o'clock every morning, that started with a small group of 5. I believe we now have 15 people on that call daily, because they're all people that we're able to pull in for information and assistance depending upon where we are in the process. And so it'll upsize and downsize as we move through the process. But that's the core genesis of that group.
Okay. My second question is what I talked to you about yesterday about, do we have a protocol if protests would come to Sister Bay?
We brought that up with the Door County Sheriff. The Door County Sheriff feels that they are comfortable in handling whatever would come up, that people are allowed to protest as long as they do it currently in the social distancing way. It would probably be allowed if it wasn't interrupting anything. If it doesn't meet the requirements of our social distancing and what we're supposed to be doing for social responsibility, then potentially there could be warnings or other issues taken to try and mitigate it.
So if this were to happen and people were not social distancing and there was a large crowd, then the protocol would be to call the sheriff.
That's what I would do at this point in time. But again, that's something we're also going to be talking about, continuing to address in the long-term opening task force and in our daily discussions with public health and the EOC, the Operations Center. Okay.
And then my third question is, I went on to booking.com today, and there are multiple places in Sister Bay that you can rent a room this week.
Mm-hmm.
I know that there is some angst within not just Sister Bay, but with Northern Door pertaining to Open Hearth Lodge. They were part of our conversation weeks ago. We knew that they were open. We knew at that time that they were renting out rooms to some of the construction workers. And then there was somebody in the healthcare profession that stayed there for a while. I don't know if they're still there. But now my understanding is that it's widespread and there are people coming from all over. And when there's a stay-at-home order, I understand that they are considered an essential business for those other essential workers that have to be out and about doing their essential jobs. But what so many of the lodging places within the village and Northern Door as a whole decided to shut down and bit that bullet like many other businesses. And it is my understanding that the owners of Open Hearth Lodge are not are choosing not to ask why people are here. Are they essential workers? And if you read Ever's mandate, it talks very specifically about, who should be out and about. And so I'm just wondering, I believe fair is fair for all. And does the village have a perspective, an opinion? We're talking, so many other businesses are shut down, and yet here's a business that is allowing anybody to rent a room anytime that they want. That is not essential. So what do we do with that?
I wish I had an answer. If you have one, please spit it out.
Denise, this isn't an answer by any means. Lars and I were, there's a group of restaurateurs that got together today to just start brainstorming, sharing ideas, etc. And one of the things, we brought that up and we talked about it and about how, there's been a lot of people going really negative to these people. And we also got to protect Door County and our brand and our everything else about being welcoming. And I said, I know we in our business and property management, we've steered people clear away and said, hey, this is the governor's order. It's also think about it this way, as much as I want to keep adherence to it. It would be like asking you at your gas station or me at Husby's to make sure the people ordering food were, with the Illinois license plate, traveled up here for altruistic reasons. So unless we're going to all do that and say, hey, you weren't supposed to be here, so we're not going to serve you gas or we're not going to serve you food, it's hard for us to ask the hotel to do it. You know what I mean? I know it's a little different because they're staying there, but there's tons of non-essential travel going on. So it's really hard to point out one business entity and putting the responsibility on them or even a group of hotels, because we're all selling to people that are not traveling for the right reasons. I guess that's just my 2 cents.
People get frustrated. Our other hotels in the area get frustrated because they are abiding by what Door County and the village asked and the governor's asked. And, you have a group of a couple that are not. And, that simply fosters, hopefully it doesn't foster, well, they're doing it, so now I'm going to do it too. And it just spreads and causes the problem. But unfortunately, if somebody chooses not to follow the state mandates or state guidelines, unless somebody is willing to enforce it, it's very difficult to do much.
And that's kind of my point, is it's hard for the business owner to enforce it. We're not the right people to enforce it. Maybe we are in lodging, possibly, and maybe that should have been an order given, but any transaction that we're partaking in and we're not enforcing, it's hard for us to do that, and I'm just saying, like, as Husby's, because those same people staying there or at their homes that they shouldn't have traveled to are coming to eat by us. So how do we say, what do we do? I mean, who's
stay with us? They call us. They're like, well, we're coming up to open our seasonal home. We're not going to go anywhere, but what restaurants are open? I'm like, none. What do you, so, but Chad, you bring up a great point. I'm so glad that you and Lars are together and talking about this, because you guys, this is this is the future. This is what will happen when everything is allowed to be open this much. And then you'll have restaurateurs who are not as thoughtful as the 2 gentlemen that are on the phone, or that are on the call with us, or retailers who are not as thoughtful as Mitch, who's on the call with us, that will just push it a little. You're always going to have to, you're going to have to account for it, and you're just going to have to move on and say, okay, like somebody calling up saying, well, they're not social distancing at Husby's tonight. Do you know what I mean? It's
Miles's point. We're going to be scrutinized more than the restaurant industry is going to be the most scrutinized. We're going to have to.
If we were to just, and I think the restaurateurs should figure this out and give input, but give some guidelines that I don't feel like will be there maybe from the state, because I don't know how they could possibly do it, right? But guidelines that could at least give some type of guidance, but maybe it's too much. I don't know.
Well, we've had some good ideas floating around, and I think a lot of it too is it becomes almost a marketing thing. Like, hey, this is what we're doing. Nothing's going to be a catch-all, but this is
You're right. You're right.
Practices.
It is.
And to help make you feel safer.
Yep.
but every business is going to have to do that.
It's absolutely a marketing tool, and it's exactly the way to look at it. Absolutely.
Right. Okay, Denise, what else you got?
Well, I really didn't get the answer that I wanted.
I know.
Can we give you a taser, Denise? Give you a taser and you take care of it?
I
I'll
have
vote
some
for that.
glasses if
I'll
you
vote
want
for
to
that in a
run over
heartbeat.
there.
Yeah, question for you, Dave. Have you, public health, the group that you meet with every day, have they talked about smart testing?
Refer
know what
smart
that-
testing because there's 70 different tests out there. So what do you mean by smart testing?
Okay. The Boston Globe had an article about it, and it was written by David Bloom, Bloom, and he's from Harvard. And it talks about, because what we have been hearing from the experts is that we are never going to be able to test our entire population. And this smart testing is you actually do less testing, but there's all this other criteria, and it gives you better protocols to make better decisions on. And I was just wondering if that had been talked about, if they knew what this was. And it's not a long article, but it's really good.
I haven't heard the term smart testing in that regards yet, but I have heard various terms about the different types of testing that are being used. And of course, everybody's waiting for the antibody testing to come out. That's effective and gets high percentage of is an effective test, basically. In a couple areas where they've done it, they've got some pretty surprising results. In the case, I don't know if you read the papers recent last couple of days about Los Angeles, tested, I think it was 800 people that they picked to get a group for a cross smattering of the group, and they did the antibody testing. And the result of that is they now figure that they probably have up to 55 times as many cases as they thought they had that tested positive with the regular test. And so it had probably been widespread for longer than they thought, but most of them were asymptomatic and never went to a doctor or called about it. But it puts the infection rate at about 2%. Is what they were suggesting at that point in time. But of course, the very ill and the death rate gets much smaller when you're able to factor in that kind of testing. Okay. I also know that there was a small town in Colorado that had about 100 or 150 cases. They tested all 3,300 residents. Okay. And out of the 3,300, like I said, they had 100 or 150 positives. They ended up with 800 and some people that came back positive for the antibody. So almost 25% of the population had actually been exposed. So it's probably much more widespread than any of us care to believe. But until there is a lot more testing going on, nobody's going to be able to come up with better numbers yet.
Do you want me to forward you the article?
Sure, that'd be fine. I'll send it to you.
Thank you. That's all I had.
Okay. Anybody else? Okay, we will move to our regular board items. Thank you for anybody that's going to drop off after we end our discussion on the COVID-19. Let's see, item number 3, discussion regarding amendment of the village's personnel policy in such fashion that a section is added that delineates the village's position on the personnel issues which may arise with respect to COVID-19 pandemic and the preferred course of action. Consider a motion for action if necessary, if appropriate.
Okay, so everyone has received a drafted policy in their board packets. This has been a living, breathing document. Since then, we've been making a lot of changes. There's been a lot of things going through the Department of Labor that have caused us to change some things. If you saw in the emails, except for Vivian, sorry, Vivian, I didn't get this one to you yet, but at about 5:20, I sent out an updated policy for our employees that we feel comfortable with moving forward on. And it basically is, it's pretty similar to the one you received, with just a few other changes and some grammatical corrections and some consistency corrections on there. But there's two portions, just from a brief overhead perspective. There's the expanded FMLA leave portion of this, and then there is the emergency paid sick leave policy. And this is consistent and pretty similar to what the county did, but somewhat fixated on what the Village of Sister Bay can handle. So it's fine-tuned and created for what the village policy can handle. The expanded FMLA leave really covers an employee who may have symptoms, cannot work or telework, or has a child that has related symptoms, and how we can handle that as a village. And it really allows them to utilize the 12 weeks of FMLA through December 31st of 2020. So that is something that's necessary here. Switching over and looking down at the meat and potatoes of this, the emergency paid sick leave portion. This really covers anybody who has symptoms or is sick and shares similar symptoms but hasn't been diagnosed. And this gives them an opportunity to utilize up to 80 hours of paid sick leave for this, with the qualifying reasons above. And it also has a chart which breaks down exactly what that pay looks like for an employee who falls under this category. So it's up to $511 per day if you have COVID-19, and up to $200 per day with the people experiencing the symptoms. So this is just a policy we need in our back pocket in case we ever do come across the event where an employee does have COVID-19. Does anyone have any questions? And just so you know, you obviously don't have to make a decision on this tonight, as you will be receiving or have received this updated copy at 5 p.m. This could be something we could talk about next week.
I do have one question, Bo. If an employee needs to take care of somebody else, who are those people? Is it spelled out?
It's directed on here. This one specifically talks about children. It's pretty difficult in the FMLA world because regular FMLA covers a spouse or a relative in there. This one is more specifically towards the children in the family who could have the COVID-19.
Okay. What if there's a single person who has a significant other and they are not married? They cannot take off to take care of that other person? I would want that change.
Sorry, I'm going to jump in here if you can hear me.
Yep.
The emergency paid sick leave by Department of Labor Law actually allows, if you look at number 4, the employee is caring for an individual who is subject to either one or two above. So they are either a person who is sick or has been advised to self-quarantine by a health professional. That is for anybody.
Okay,
it can be
good.
your neighbor, it can be your friend, it can be your spouse, your fiance, whatever.
It just has to be documented so that we can have that for our records.
Yep.
Okay, excellent. Thank you.
So once again, you don't have to make a decision on this. You can take your time and read the document. Please send me any comments in the meantime, and then hopefully next Tuesday we can get this into our policy.
Any other questions on that? Okay. Item number 4, discussion regarding adoption and passage of a resolution that authorizes village president to submit an application for outdoor recreation grant on behalf of the village of Sister Bay. Consider motion for action if appropriate.
Yes, so this is something that we need to have a resolution passed on in order to submit the grant for Pebble Beach. We are nearing rounding third base, coming to home. We're just doing some final touches with Terry Cooper at the Land Trust. We've been working really diligently to get this fine-tuned. I would be happy to send people the final copy if they'd like to review it before we submit it. I'm hoping to get this out by next Tuesday. That's the goal here, is we need to meet that May 1 deadline still. So we're looking to have a final file with all of the information included by Thursday.
Any questions?
I was hoping this was for the Denise Berto Memorial Splash Pad in the park, but it's not. Darn it.
That's next.
Louise, I actually have to die for that to happen.
Well, no, Denise, I'm trying to get it before you die so you can use it.
I was just worried Dave was buying more land.
Don't show him.
I stayed on.
Don't show him the attachment, Bo.
Not included.
Okay.
Don't worry, Denise. We'll get you that. We'll get you out of scanned in your wheelchair. We'll wheel you right across.
Okay, let's bring it back. Let's bring it back. Okay. So, although it would be funny, a wheelchair across a splash pad. Anyway, we need a motion.
So moved.
I'll second it, Dave.
Any other discussion? All in favor? Aye. Opposed? That is carried. Thank you. Item number 5, discussion regarding the recommendation from the Plan Commission. Village Board pass and adopt resolution number 41, which approves the plat for Shoreview condominiums, which was submitted by representatives of Harbor Development SB LLC for parcel number 18142300001A, which property is commonly referred to as the old schoolhouse property. Consider a motion for action if appropriate.
So moved.
Second.
I just want people to know we did have a trustee, Vivian, who caught an error in the condo documents. I have spoken to Chris, and he has sent me a corrected version. There was an error in section 8.04, which was page 9 of the documents, that had 43 votes in the association. That was an error on their part. We do have the correct one, which shows 18 votes in the association, which does mean that there's 1 vote for each dwelling unit in there.
Okay.
I just also had one question on page 32, section 5.04, conflict. Under section B, I don't have it pulled up here. It's 3 or 4 lines from the bottom of that little paragraph, section B. The word in there is NIT, N-I-T. I'm just wondering if that's some kind of legal term I'm unaware of, or...
I'm going to go ahead and assume that should be not. We'll make that change.
Okay.
It looks like it should
Unit.
be unit.
I think it's unit.
Unit? Okay.
Oh,
Yeah.
yeah, that is unit. Yep, it's on the 3rd to last line in B. Yeah, we'll get that change on there.
I think NIT has something to do with head lice, but I'm not sure.
Okay. Anything else on this one?
Very nice, Chad.
Thanks for the
All
correction.
in favor?
Aye.
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 Opposed? Carried. Thank you. Item number 6, discussion regarding and confirmation of President Lino's recommended appointments. We just had our swearing-in ceremony tonight. By the middle of May, which I believe the next one would be, we'd be meeting on the 12th, is when I would try and make committee appointments. I will contact everybody, talk about your committee preferences, changes, additions, whatever else you would like to do or see, and then we'll come up with the committee appointments after that. Also at that meeting, I just want to make a note now while I remember it. That's also when we would talk about what, if anything, we would do with our current emergency declaration that's in place, because that's due to sunset on the, I believe it's the 17th.
Yes.
And so we can talk about it on the 12th and decide what we'll do at that time. And since that's still, a couple of weeks away, several weeks away, I'm sure things will be changing at the state level, and everything else will have more information to operate from.
Okay.
Item number 7, reporting county activities from County Supervisor Dave Lino. Well, I'm happy to report that today was the county reorganization day. It was the reformation of the new county board for the next 2-year term. I was given the privilege again of being reelected as county board chair, which I'm thankful for, and I appreciate that. So I don't have much else to tell you, except that it was a very long meeting. We were trying to do it virtually. And in the middle of it, we kept getting kicked off. It took about an hour and 15 minutes for everybody to get on board the first time. But once everything was up and running, we came up with an electronic voting system that worked really, really well. And it might be something we look at if we need to at some point in time, if we need roll call votes. A very, very simple app that just pops up, and the question is there, and you vote on it, and it tallies it and records it. I was very surprised how well it worked, and we did a number of votes on that for committees and such today. So that's what I have on county activities, unless somebody has a question about it. Item number 8, report by village administrator and village activities and projects. Bo.
So I didn't include an administrator's report. It's been very busy. I'm going on a limb and saying about 90% of my life has been dedicated towards this Pebble Beach grant. I haven't really taken my eyes off of it besides the policy that we're working on. I want to make sure that we get the best possible outcome on that grant moving forward. Other than that, I would say all departments are going full steam ahead. We've had no issues to speak of. Parks Department has been working diligently to get things prepared and ready as they can for the summer. And utilities has been moving forward. So nothing to report at this time.
Okay. Any questions of Bo? Okay. Review the financial statements and consideration of a motion to approve the monthly bills.
I'll make a motion to approve the monthly bills.
I'll second.
Any questions? Any invoices? Any answers required? Tasha's ready.
I'm working on it anyway.
If not, all in favor?
Aye.
Aye.
Opposed? Carried. Item number 10, committee reports. We'll go down the list. Admin has not met. Admin and comp oversight has not met. Common technology has not met. Coastal byways. DCECD. Economic development. Finance. What?
Finance is meeting May 5th, right, Tasha?
Right. Finance is meeting, yes, May 5th, and then there will be some stuff coming May 12th.
What time on May 5th?
I don't know that we established a time.
Yeah, I was hoping to get it done maybe like 2 p.m.
Okay. I'm okay with that. Fire,
Has not met.
Fire District, Historical Society, no. Holiday Lighting, no. Library, no.
Oh, Dave,
Yes,
question about the library.
yes.
So in Evers said that libraries can open up for ordering online and pickup.
Drop off, yes.
I don't remember seeing a date if that was being implemented right away or if we had to wait until the end of April 24th. And would we need to, the village board, because we originally closed that down with everything else, would we have to then ask the county to reopen it? What do we do with that?
I have an answer for that one.
Excellent.
That was a discussion, the early morning meeting. The library, main library will reopen for the pickup and drop off. The rest of the branch libraries will remain closed.
Okay.
Till such time as we would move farther into phase 1 or phase 2.
Okay, so Sturgeon Bay only.
Yes.
Do we
What
have
they
a date?
have done, however, is in order to maintain access to Wi-Fi, they have increased wherever possible signals and Wi-Fi. So it covered a larger area, and that included, of course, all the libraries. But the county did that throughout the county. Anywhere that a county building is or county function that had some type of public Wi-Fi that was available, they were all boosted the signals to max so people could just pull up outside of a building and be on and use broadband Wi-Fi. So you should be able to go near any county facility, basically, and any library, and from out in the parking lot, be able to log on.
Thank you.
So I have a question. Why would other libraries not open?
Yeah, I'd like to know.
Because they are county staff, and the county staff on the libraries are, quote, non-essential personnel at this point in time. So until that personnel change is made by the state, there's nobody to staff it.
So if the governor says you can open libraries and all libraries are municipal libraries, are they not?
He hasn't said we can open it yet. You have to get in through phase 1, okay? And then you have to get into essential and non-essential personnel. So everybody working at a library is not, quote, considered essential. Some are, some are not. There's not enough essential personnel to staff all the branch libraries at this point in time. This also have to do with the number of people that are taking leave or are taking the potential furloughs or are taking the FMLA and or are taking the special SBL fund. You're talking about over 300 people that have to be worked through to come up with it. But at this point in time, what the county has decided to do, the first thing they would do is phase in back to the main library, and then as appropriate, begin to phase into the branch libraries. But they cannot open all of them at the same time from a staff perspective. That was the issue.
Okay.
Well, and we don't know when that date's going to be. So there's nobody, we can't say be ready on April 24th because we haven't been given a date yet. The date may be May 26th or it could be June 15th. We don't know. So until there's an actual date, they can't move forward on it.
So even for the partial opening, the pickup.
Which would only be at the main library at this point in time.
But right now that would start.
No, I don't know that.
Okay, I needed that clarification. Okay, thank you.
Right, it's based on phase one. Right.
Okay, phase one, got it.
Okay, Marina Fest.
Marina had a meeting. We're continuing to discuss, as things evolve, how we're going to handle things, just like we're doing at this meeting. No real decisions have been made. We're just continuing to gather data and talk about it.
Okay.
Pat, are you having another meeting in the near future?
May 5th, I believe, 2 weeks from now.
Okay.
Parks has not met. Personnel has not met. Plan Commission, I think you saw the results of that tonight. Do you have anything to add, Denise?
I do not.
SBAA, no. Tourism Zone. Utilities,
Nope.
Youth Center, no. Ad hoc ice rink, no. Emergency management, nope. That's the committees. Anything to add, or anybody want to bring up anything on committees? Okay.
Well, there were, I don't know if Louise wanted to add anything additional. We did have 2 sets of minutes, I think, from SBAA. Seeing that she's here with us, did you want to add anything from your last?
No, we're having another meeting this coming Friday. We would normally not have a board meeting. We only have them once a month. We're having an interim one because we were waiting to get the next order from the governor. Sure enough, we have one. So we're having a meeting on Friday to discuss upcoming events because we have to make decisions on, the most immediate ones. And we've been in communication with Al's about the most immediate one, which would be the goat parade. And, it's the last few years we've had 3,000 people for that event, and that is on June 14th. And then the next one that comes up is Sunset Yoga, which starts on June 22nd. That's offered, it's free, it's in the park. It certainly could be some social distancing, but the big one would be concerts and movies. We won't make any decisions at this. Certainly we would talk to the village and work through that. The next big one would be concerts and movies, and the first concert is June 24th. So I think the idea, we have to talk to Al's about the goat parade, but based on this last order, I think we'd probably postpone, not cancel necessarily, but postpone and see what we can do.
Okay.
What did you say was the first concert, Louise? What date?
It's June 24th.
Okay.
And they're every Wednesday. We have one that's a little bit out of sync. We have a Monday night where the Doris Symphonic Orchestra is playing. I did speak with her today, and she thinks she's ready to go. Many of their members, if she still has to reach out to, but that's a Monday night, very flexible. We can always move that around. And then if we needed to, we could take our first 2 concerts and move them towards the end of August. We deliberately don't do concerts at the end of August because that's usually a quiet couple of weeks because kids are back in school. So we don't usually do the last 2 weeks of August. So maybe we could do that if it looks like those first two concerts, which would be June 24th, and then the next one is July 1st, and that one is Copper Box, and that is usually, it's close to July 4th weekend, and that's usually pretty well attended. And actually the first one is Modern Day Drifters, and that's one of our most popular concerts. So we need to talk a little bit about that.
Okay. Is that it, everybody? Okay. So we will move from committees and move to item number 11, discussion regarding matters to be placed in a future agenda referred to committee, official, or employee. We've got a couple of those down already. I guess I would like to have one where we talk just on rollout of what we would do or try and do, working with the businesses, working with SBAA. One of the things that Louise and I were talking about was, just as an example, if you look at the concerts, is there something we can do to limit the number of people that would come to a concert, keep social distancing, and still be able to have the concert? I think with regard to our concerts in particular, I think festivals are different, but with regard to our concerts, there may possibly be a way, if we can figure it out, to meet the social distancing requirements and maybe limit the availability of the concert and potentially also stream it live. I don't know what legal issues you run into that, but
I wouldn't think, no, we can't stream the movies, but we could probably stream the concerts.
right. I'm not talking about movies, just concerts.
Yeah, I know. Yeah.
But something to think about. But I think one of our meetings should be just talking about how we can help businesses and get businesses involved, get Louise involved, get other people involved to get some ideas, because I think we're better off, like when we talk about concerts, if we can go to the state, the public health, and say, here's what we would do, and here's how we would do it, and here's how we would handle it. If we go to them with a positive action plan, I think that's better than if we don't do anything and we let them say, nope, can't do a concert, can't do this, can't do that. I think they're open to positive plans that meet the social distancing requirements and meet mitigation requirements. And I think it's in the best interest of Sister Bay in general to see if we can't come up with something relating to the concerts.
Mm-hmm. Yep.
But.
Well, one thing about music too, it's not just us that has, we got music every night of the week in Sister Bay, and certainly a lot of it is Huskies. Mm-hmm. But there are other, Boathouse in the Bay has music. There's a lot of people that have music. So, I mean, I guess it's, they would be under the umbrella, whether they have music or not, of a restaurant. So
I think the difference being is based on whatever limitations we have, we're not going to be able to afford to have music because we need to have so many people that justify spending the money.
Yeah.
Right. I do agree with Dave, whether beyond even just concerts, anything we can kind of do to formulate our own way through this is not going to hurt us any to start thinking about it.
Sure, I agree.
As far as streaming, one comment on the streaming, I'm not an expert, but I would say stay away from it because all these artists, unless they're paying for their ASCAP stuff, that when they cover a song, you're just as,
Oh yeah, you're right.
You're right. Okay.
I would just stay away from even trying to do that because it's only going to open up a can of worms.
Okay. And that's all.
The kind of things we need to discuss. So.
Yep, I agree. Yeah, I agree.
Mm-hmm.
Okay. Anything else on the future agenda referred to a committee? Excuse me. All right. So we will move to item 12. Consider a motion to convene an executive session pursuant to Wisconsin statutes 19.851E to deliberate or negotiate the purchase of public properties, invest in the public funds, or conduct other specified public business whenever competitive or bargaining reasons require a closed session. Wisconsin statutes 19.851G to confer with legal counsel for the governmental body who is rendering oral or written advice concerning strategy to be adopted by the body with respect to litigation in which it is or likely to become involved. Motion by Lino.
I'll second.
Okay. Roll call vote. Lino, yes.
Baker, yes.
Al, yes.
Berto, yes.
Bronco, yes.
Duffy, yes.
Eno, yes.
Okay. So we're now in closed session. So anybody who is not an immediate member of the board other than Bo and Tasha and Janelle will need to drop off and or we will disconnect you.
Yeah, I'm going to give it about 10 seconds. I'm going to start disconnecting.
Okay.
Okay, now before we go into the closed session, did you want to have that detailed discussion regarding emergency planning and stuff at